everyone. This is Sean with the MassSupport Network here with the COVID-19 update for Friday, January 8th, 2021. So while most news sources have been distracted from the pandemic by events in Washington earlier this week, the virus is still raging on in some of its deadliest days ever. Now, it's been a couple weeks since we did a update on Fridays due to the holidays, and the numbers have not really fully recovered from the data slowdowns, backlogs, drop in testing, etc. So there will still be some irregularities here. We last checked in on Friday about 3 weeks ago, and in that time, there were 23 million additional COVID-19 cases, with 6 million more in the United States and over 100,000 additional cases in Massachusetts. In terms of deaths, over 300,000 people have died since mid-December, with 73,000 in the United States and 1,700 in Massachusetts. When we look at the charts, see that yesterday was the deadliest day of the pandemic, with the day before that as the previous deadliest day. Now, of course, there are backlogs here that may account for some of these numbers, but it's still a huge amount there. As you can see, testing has not fully recovered or anywhere near fully recovered from where it was prior to the holidays. But despite that, case counts are already on the rise past where they were. And deaths as well. Hospitalizations are still at or near their records, with over 130,000 people in hospitals right now with COVID-19. And of course, remember, with any numbers like that, there are still plenty of people in hospitals for other reasons. This is just the number with COVID-19. When we look at where the virus is right now, or where the trends are recovering from the holiday slowdown, you can see that most of the country is back to where it was before the holiday break. Northeast and South have more or less continued their trajectory. Northeast was a little bit plateaued. Remains to be seen if we're increasing again or if this is just backlogs, but the South appears to just continue the same trajectory it was on. Whereas the Midwest has rebounded, but seems to still be on that same downward arc. And the West has not reached its peak from before the holidays, and it's unlikely that it's going to be dropping off suddenly there. As you can see, those other little hook there, which was, of course, Thanksgiving. Hospitalizations are, of course, the one trend that is not affected by holidays. And this chart shows all the various states with their hospitalizations per million people. Remembering that the peak was 968 people per million hospitalized in New York in April. And you can see, while we haven't reached that level yet anywhere, we have some significantly high points across the country without any one clear center anymore. And additionally, a lot of these states have much fewer hospitals than, say, New York City. So a lot of these places are very near to being overwhelmed. And recently, this week, we saw what can happen when a hospital is completely stretched past its limits, as an entire ICU ward in Egypt passed away when their oxygen supplies just completely ran out and everyone in the ward died. So it is definitely disturbing there. And just looking at the regions, see where the trends are going. Midwest is still continuing to taper off. Northeast is slightly rising, and the other two regions are still climbing. The past week has shown the highest hospitalizations in 15 states. Now, with sometimes we show this chart that shows when the week of the highest single day the cases were, and that can be thrown off by backlogs. Often things will be, the week after holiday will be the highest just because there's things being 2 days of data being reported on a single day. This is hospitalizations, and this is not going to be affected by that. And the fact that 15 states are already at the highest point they've ever been for hospitalizations. There's just a couple of us in the Northeast left from the early days of the pandemic there, and then the rest of the country is seeing its most hospitalizations in the last month and a half, but most of them currently active right now. So that's a very disturbing trend there. There's 15 states here that things are going to get a lot worse in. We actually look at deaths. These are actually very slow to rebound after a holiday because the reporting process seems to be fairly bureaucratic and have to go through several steps. The Northeast seems to have gone back in the trajectory it was, and that is climbing fairly steadily there. The Midwest has reached a plateau, and it's hard to say if that's where that's going there. But despite the fact that the West was the one that had not recovered to its previous stat, we are still in a trajectory that's continuing up there, and the South is still catching up there. So we're likely to see significant increases as this winter continues. January, February are likely to be very rough times for this pandemic. Looking at developments this week, first of all, we had some data on the allergic reactions to vaccines coming in at approximately 1 in 100,000 doses administered. So that is a very low number. And of course, remember that the death rate from COVID is much higher than that, people who become infected. And of course, anaphylaxis is quickly treatable in hospital settings where vaccines are being administered currently. Also in Massachusetts, we are going to start expanding vaccinations out to first responders starting on the 11th. Currently, the US has given just under 6 million vaccines. So here in Massachusetts, report as of yesterday was 141,000 vaccines have been administered, with just over 1,000 being the second dose for people in hospitals and long-term care facilities. So as these next couple months go on, we are going to see worse numbers in the case counts, but we will see this these vaccination numbers really start to ramp up, hopefully, as we start to get our vaccination mechanisms under control and scaled up. Also, kind of buried under the other news this week, a couple interesting studies out recently. One on convalescent plasma, which is, of course, a blood product taken from people who have recovered from COVID-19. There's been some debate about its usefulness in administration to help people recover from COVID. Most data was showing that it was actually not very helpful, but the newest study shows that if it's given fairly early in the process, in the infection, it can be effective. Of course, early in the infection is not generally a time when people are going to be in a setting where they can receive a blood transfusion. It's not really a convenient outpatient tool, so it just makes it a little more complicated there. Also, another study showed that infection rates have been significantly higher in countries that have been holding university and college classes in person, which really shouldn't be surprising, as we've seen again and again that while potentially younger children are not as spreading the virus as much, teenagers and young adults are, of course, going to spread it just as much as older adults. So with that, we'll close the week there. You can find our sources in the usual spots: COVID Tracking, New York Times, and mass.gov. And for more from the MassSupport Network, you can find us on our website or on social media. We'll be back next week. We'll resume the Massachusetts Public Health Reports on Fridays. Until then, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.